Welcome to our education and health awareness on kidney disease. I'm Gayla Lee Chambers, along with Sierra, a senior at the University of Omaha studying psychology. This short informational training session, you will learn more about kidney disease and how this diagnosis can affect your mental health.
So what is kidney disease? Kidney disease can affect your body's ability to clean your blood, filter extra water out of your blood, and help control your blood pressure. It can also affect red blood cell production and vitamin D metabolism needed for bone health. Types of kidney disease include chronic kidney disease and long-term condition that doesn't improve over time. It's commonly caused by high blood pressure. Kidney stones are another common kidney problem. They occur when minerals and other substances in the blood crystallize in the kidneys, forming solid masses. Glomerulonephritis is an inflammation of the glomeruli. Glomeruli are extremely small structures inside the kidneys that filter the blood. This can be caused by infections, drugs, or congenital abnormalities, disorders that occur during or shortly after birth. It often gets better on its own. Polycystic kidney disease is a genetic disorder that causes numerous cysts, which are small sacs of fluid, to grow in the kidneys. These cysts can interfere with kidney function and cause kidney failure. Urinary tract infections, or UTIs, are bacterial infections of any part of the urinary system. Infections in the bladder and urethra are the most common. They are easily treatable and rarely lead to more health problems. However, if left untreated, these infections can spread to the kidneys and cause kidney failure. What are the symptoms? Some symptoms include nausea, vomiting, loss of appetite, fatigue and weakness, sleep problems, changes in how you urinate, decreased mental sharpness, muscle twitches and cramps, swelling of feet and ankles, persistent itching, chest pain if fluid builds up around the lining of the heart, shortness of breath if fluid builds up in the lungs, and high blood pressure or hypertension that's difficult to control. Don't procrastinate. Seek medical advice from your doctor for these reasons. Fluid retention, which could lead to swelling in your arms and legs, high blood pressure, or fluid in your lungs. A sudden rise in potassium levels in your blood, which could impair your heart's ability to function and may be life-threatening. Heart and blood vessel disease, weak bones, and an increased risk of bone fractures or anemia. Also, could it cause decreased sex drive, erectile dysfunction, or reduced fertility, damage to your central nervous system, which can cause difficulty concentrating, personality changes, or seizures, decreased immune response, which makes you more vulnerable to infection, pericarditis, an inflammation of the sac-like membrane that envelops your heart, pregnancy complications that carry risks for the mother and the developing fetus, irreversible damage to your kidneys, end-stage kidney disease, eventually requiring either dialysis or a kidney transplant for survival. What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. How do you know if your medical condition is affecting your mental health? Mental health problems may develop because adapting to chronic kidney disease is stressful for the individual and family members. We may feel our body and general situation are out of control and there is nothing that we can do. We feel lonely and isolated from family and friends. Sometimes it can be difficult to talk about the illness with those close to us. We don't want to worry or upset them. How having kidney disease can affect you emotionally. People with chronic kidney disease and those who care about and for them can have a range of emotional responses: shock, sadness, grief, fear, anger, frustration, feeling down, tense, or alone, and sometimes many of these. Some losses may seem relatively trivial, like limiting social engagements or shifting housework to a partner. Yet these can be important and may signal changes in relationships, such as greater dependence. Where should you go for an assessment and/or evaluation? You can see your primary care physician, a licensed counselor, community health clinics, or your local hospital.
Our tip for the day: know your family dynamic and drink plenty of water. This concludes our education and awareness on kidney disease. I'm Gayla Chambers along with Sierra, and we hope that this was helpful and that you have a great day.